Alberta is pushing to remodel its healthcare system by allowing some doctors to practice in both public and private care.
Alberta patients will continue to receive care through a strong public health system, but will also have the option to purchase services they are currently waiting for.
So that was Alberta's primary care minister, Adriana LaGrange. Alberta's dual practice model, Bill 11, aims to shorten surgical wait times and attract more physicians to the province. But some critics are concerned this is going to lead to a two-tiered healthcare system. For a closer look at the proposal, I'm joined by Dr. Braden Mance, kidney doctor and a professor of health policy at the University of Calgary. Good morning.
Good morning. Thanks for having me.
First of all, because this is new, set out for us who is and who is not allowed to participate in this dual practice model.
Well, it changes by the day. And initially the legislation was leaked. So I think the Premier's announcement, it wasn't clear. It's actually open to all physicians at this point, but they do have some guardrails that they can bring things back in. Now, initially when Minister Jones mentioned this and was asked about family medicine, he wasn't sure. A few days later, they said family medicine's out, and it seems like this is going to really be focused on elective surgeries, cataracts, knee surgeries, that type of thing, at least at this point.
At this point, elective surgeries and not family doctors. So if passed, Alberta will be the first province not only to offer public and private health care, but also the option to work in both for some medical professionals. How will that work? Explain the logistics of that to us.
Yeah, so this is different than what Quebec has. So in 2005, when the Chiarulli Supreme Court decision essentially forced Quebec to offer a parallel private system, they said physicians, the way they regulate it is everybody, you either opt in to publicly funded healthcare or you opt out. You can't be in both systems. So Alberta has essentially gone way beyond that and said you can have a dual practice model where in my same clinic, I can see some people and I can bill the minister, but also I can bill patients. So if my wait list is long, I can offer to see them in the next week, and I can charge 2-3 times the amount in my same clinic. It appears that I'll have to use a different electronic medical record, but essentially it allows me to float back and forth. And that's really going to open up this parallel private system like we haven't seen it before in Canada.
I have some more questions surrounding that, but first I want to know, the province is saying this is definitely going to shorten wait times, but you disagree with that. What is your reasoning?
Oh, it's going to absolutely shorten wait times if you can afford to pay, which is why this is two-tiered healthcare. If you can afford to pay, physicians, surgeons, and the chartered surgical facilities, which are these for-profit private surgical clinics, and there's two things going on in Alberta. There's these for-profit chartered surgical facilities. Those are tax funded. And those will continue to expand and offer services, and they'll prioritize patients who can pay because they'll get paid more for those types of surgeries. So that's happening. And at the same time now, we're going to prioritize our scarce resource. And that's the reason that this won't work to shorten wait lists in the public system, is that we have only so many, and it's not just the surgeons. I think some of the surgeons will be willing to operate in the evening. Some will be willing to operate on the weekend if they actually regulate it. The challenge is the anesthetists are burnt out. The surgical operating teams are burnt out. So what we've seen in Alberta is the more surgeries we do in these chartered surgical facilities, the fewer we're doing in our publicly funded facilities. So we're really just changing the location of where we're doing surgeries. But if you need the support of a hospital, if you've got cancer and you need to be operated on in the hospital system, what we've seen is that wait lists have maybe gone down slightly in the chartered surgical facilities, but they've gone up over the past few years for people with cancer and people needing surgeries in a hospital.
And if I spent a little bit of time working through this yesterday, and if I understand this correctly, the problem is we're not adding any new healthcare providers. So the fact is the wait times can shorten when, depending on which location you're at, private or public, but the same amount of people need to be done to do the surgeries, and there's just not enough of those.
Yeah, the problem is because governments essentially are in charge of healthcare, they don't have they don't take a long range focus, and we don't do a good job of health workforce planning. So we've got a fixed number of, we're really scarce, we're really short of family docs, anesthetists, psychiatrists, we're short of operating room nurses. So when you've got a fixed resource, we just can't create those out of nowhere. It's going to take us a while to actually train those. And right now we're still not really, we're not training more anesthetists. We're not training more of the things that we need to actually shorten the wait list in both systems. We're not dealing with the actual problem, which is that some people wait years, way longer than they should, and others get done quite quickly.
Dr. Braden Manns, kidney doctor and professor of health policy at the University of Calgary, not Canada. I know that they're still working through this in the province of Alberta, so we appreciate your update this morning.
You're welcome. Thanks.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.